Imagine waking up one morning and looking in the mirror. Everything seems normal until you try to smile and one side of your face just won't cooperate. This unsettling experience, often accompanied by a feeling of numbness or weakness, can be the beginning of a condition known as Bell's palsy. Named after the Scottish surgeon Sir Charles Bell, who first described it in the 19th century, Bell's palsy is a temporary condition that causes sudden weakness or paralysis of the muscles on one side of the face. While alarming, it's important to remember that Bell's palsy is generally not a sign of a serious underlying condition, and most people recover completely with time and proper management. This essay aims to demystify Bell's palsy, exploring its causes, symptoms, diagnosis, treatment options, and long-term outlook. Understanding this condition can empower individuals to seek timely medical attention and approach their recovery journey with knowledge and optimism. Throughout this exploration, we'll follow the journey of a claymation character named Clay, who suddenly develops Bell's palsy. Through Clay's experiences, we'll learn about the condition and the steps involved in diagnosis, treatment, and the road to recovery. If you found this video helpful, don't forget to like, share, and subscribe to the Diseases and Cure channel for more informative content. While the exact cause of Bell's palsy remains somewhat of a medical mystery, research points to inflammation of the facial nerve as the primary culprit. This inflammation disrupts the nerve's ability to transmit signals to the muscles it controls, leading to the characteristic weakness or paralysis. The facial nerve, a crucial player in our ability to express emotions, controls a wide range of facial movements, from blinking and smiling to raising eyebrows and wrinkling our noses. It's like a complex network of electrical wires, and when these wires become inflamed, the signals get disrupted, resulting in the malfunctioning of our facial muscles. Viral infections are strongly implicated as a common trigger for this nerve inflammation. The herpes simplex virus, notorious for causing cold sores, is often identified as a potential culprit. Other viral suspects include the varicella zoster virus, responsible for chickenpox and shingles, Epstein-Barr virus, associated with mononucleosis, and cytomegalovirus. Bell's palsy typically announces itself with a sudden onset of symptoms, often developing overnight or within a few hours. The hallmark sign is one-sided facial weakness or paralysis, which can range from mild drooping to complete immobility. Imagine Clay waking up one morning and noticing his reflection is different. One side of his face feels stiff and heavy, and his smile looks uneven. He tries to raise both eyebrows, but one stubbornly refuses to budge. Besides facial drooping, other common symptoms can include difficulty closing the eye on the affected side, leading to dryness and irritation, drooling due to impaired muscle control, alterations in taste perception on the affected side of the tongue, increased sensitivity to sound in the affected ear, and pain or discomfort around the jaw or behind the ear. Diagnosing Bell's palsy typically involves a thorough physical examination and a review of the patient's medical history. A doctor will carefully assess facial movements, checking for muscle weakness and asymmetry. They'll also inquire about any recent illnesses, particularly viral infections. Recovery from Bell's palsy can be a journey, but with the right steps, many people see significant improvement. It's important to follow your healthcare provider's recommendations closely. Physical therapy exercises, for example, can help strengthen the facial muscles, and keeping a positive mindset can make a big difference too. Some folks might see progress in a few weeks, while for others it could take a few months. Patience and persistence are key. While the journey can be challenging, there is always hope for a full recovery. Many individuals do regain full function with time. Staying informed and engaged with your treatment plan is crucial. Support from friends and family can also provide comfort and encouragement. Remember, every small step forward is a victory, so keep hope alive and trust in the process.